Welcome and thank you everyone for coming today. My name is Michelle Oxford. I'm the president and CEO of the Bakersfield Heart Hospital. Many people in our community suffer from chronic obstructive pulmonary disease. And these patients struggle with the daily tasks because they simply can't take a full breath. Bakersfield Heart Hospital is excited to bring the endoscopic lung volume reduction procedure to the Central Valley. Thanks to Dr. Goyle, and one of our local pulmonologists, as well as Brian Pasqua, our Director of Respiratory Medicine. In conjunction with Pulmonx for the Zephyr device, patients can once again return to the life that they once enjoyed. We also appreciate our patients, Mr. Roman Welton, behind me, and Ms. Eva Horton, who came, both of them today, to share their experience with us. We're going to also thank Erin Henderson, who is here with eMedia, who will be facilitating the discussions this morning. So we would ask that you please hold your questions to the end, and I'd like to introduce Dr. Goyle.
Hi, good morning. So, like Michelle was telling you guys, we have this procedure. It's called endoscopic lung volume reduction. It's the very first time we have started doing this procedure in Central Valley. For patients who have severe emphysema, who have air trapping, hyperinflation, and we can put in these small Zephyr valves in the lungs to cut down the air trapping of the lungs and help improve the lifestyle, help improve the breathlessness in patients who have severe emphysema. It's a very novel procedure. Up till now, we did not have any surgical or interventional methods to help patients with severe emphysema. All we had was inhalers and using oxygen, and they still remain severely breathless. So with this procedure, we have been able to cut down the air trapping and the hyperinflation of the lungs, and it improves their dyspnea score, it improves their quality of life drastically with this procedure. And we have done it on 5 patients up till now, and we have had drastic improvements. I have 2 patients here, and they can speak for themselves, and they can tell you about how much improvement they have noticed. So a screened patient, when he gets the valves, the expectation is over a month or so, they will continue to improve in terms of their shortness of breath, in terms of their breathlessness. They should be able to have improved exercise capacity. In some circumstances, the oxygen requirements may improve, and overall the quality of life of the patients. A lot of these patients, they were homebound in the past. They could not go around to stores. They could not do what they wanted to do. They could not go in the backyard and work there. So we have been able to provide them some of that functionality back, and that's what we are expecting from this procedure. The valves, they're designed to stay in the lungs, but they can be taken out if there is any reason for them to be taken out, if there is any complication. The rate of complications in the studies have been very, very low. So unless we have to take the valves out, they stay in the lung for the rest of the life. So FDA approved placement of these valves in 2018. It was actually fast-tracked by FDA based on the evidence from the Liberate study that was conducted here in the United States. And also these valves have been in practice in Europe for a long time, and about 15,000 patients have been treated with these valves already with very, very good success. So this is not a trial at all. This has been completely approved by FDA, and it is a treatment option available to severe emphysema patients. The patients who are very hyperinflated, which means who have a lung capacity, which we measure with FEV1, which is the measure of how much air comes out in the first second of the forceful breath, is less than 50%, and who have a lot of hyperinflation, which means when they exhale out all the air, the minimum amount of air left in the lung is still a lot. It's about more than 150%. who are very severely short of breath when they're walking, patients who are dependent on oxygen. Those are the initial criteria to start looking for this procedure. Then once you identify those patients, then you have to do some more screening on these patients. That would include a CT scan, a pulmonary function test, and once the CT scan is done, then we look for patients whose lungs are anatomically in the best position to have these valves done. So that's what the way to find the patients is. Right now, this procedure is only offered in Bakersfield Heart Hospital here in Bakersfield, in the whole Central Valley. And we have a number that will be displayed for the patients or anyone who is interested in more information. They can always contact that number and we can give them more information about this procedure.
And I'm here to let you know that this procedure has given me a new life. Before, I wouldn't be able to stand up here and talk to you and breathe. And now I can. It's amazing to be able to walk from here out to the car without having to stop 5 or 6 times. So anyone who has a hard time breathing knows what I'm talking about. You take a few steps, you stop, you breathe, try to catch your air. Now I don't have to do that. I can go to the store, I can drive my truck, I can go places with my wife that I couldn't go before. I can go out in the backyard, I can walk down to the corner. I'm able to do a number of things that I was not able to do before, for the simple reason that now I have my lung capacity is larger and maintains the oxygen longer, so I can breathe easier. And thanks to Dr. Goyle, who told me about the procedure and wanted to know would I be interested in it, I jumped on it. I said yes, and I highly recommend it to anyone who is having problems breathing. If you get a chance to come to the Heart Hospital here, and my pulmonologist, Dr. Goyle, I'm sure will take care of you. Absolutely not. As soon as he told me about this and how the United States was going to be able to do this, because this procedure had been done in Europe and for years, and we just got permission to do it here. And when he explained all that to me, and then he told me what these valves will do, will get rid of your carbon dioxide and give you more oxygen to maintain, it was unbelievable. And I said, he asked me, would you be interested in it? And I said, yes, when can we do it? So anyway, I was really tickled. And I might say one thing: if you have to go to a hospital to have something done, you want to come here, because the people here and the doctors here and all the staff are superior to anyone I have ever encountered. And that goes from the best doctor here to the administration to the people who clean the floors. Everybody has a kind word, is very patient, does all kinds of things for you that they don't have to do, and you never be without someone watching over you. So I'm very pleased to have been a part of that.
Thank you. I appreciate you sharing your story.
Thank you, ma'am. Have a good day.
I was pretty much homebound. I didn't do anything. I didn't go anywhere. I didn't have the energy to do anything. I didn't even go out in the yard and do my flowers or anything. My husband did all the grocery shopping. Since the procedure, my husband says I cost him a fortune because I'm out shopping all the time. I mean, I just go. I go and do like anybody normally would do. You know, no hesitation. It took about 6 weeks to feel the way I do now. You know, at first, I thought, oh, this isn't going to work, but then it started. I noticed little by little, and then at 6 weeks, I was full of energy. So, I mean, it's the best thing that's happened to me in a long time. Have it done. Don't even hesitate. Just come here and have it done. You know, it'll change your life. I've told many people about it, and they've talked to their doctors, and their doctors have not even heard about it. So that's why I'm here today, is to tell people about it.